Hi, my name is Nancy Talam. I'm going to have a presentation for you on effects of COVID-19 vaccine in Colorado. The first COVID-19 immunization outside the clinical trial setting was given on December of 2020. It was projected that in December 8th of 2021, 45.5% of the world population would have 2 doses of COVID-19 vaccine, which is the booster dose and at least one other dosage. Despite this incredible speed with which COVID-19 vaccination were produced in 2020 and then administered in 2021, over 3.5 million deaths associated with COVID-19 has been observed globally since the initial vaccination. More than 1 in 4 COVID victims in Colorado perished after vaccines were made readily available. The state essentially abandoned any pandemic health restriction and the government. Early figures from CDC showed that COVID-19 caused more than 10,000 deaths in Colorado, but more than 2,900 of those deaths happened since the start of July. Effects of COVID-19 vaccine on mortality rate. A team of scientists from Israel and the United States has evaluated the effectiveness of COVID-19 immunization in reducing the risks of death among persons aged 70 and over. And the country were unable to pass the herd immunity threshold despite swiftly immunizing the adult population. In a statement by Jared Polis, he asserted that COVID-19 death toll would have significantly been higher if Colorado did not receive immunization of the vaccine. 70% of Colorado adults have taken at least 1 dose when the current wave began. 69 of the eligible Coloradans under the age of 5 are fully immunized at this time. Also, there is number of people infected by virus will progressively decrease over the following years if they continue not receiving the vaccine. CDC data also shows that COVID-19 has been responsible for 14% of all the fatalities in Colorado after the more virulent Delta form took control in early July. Even with continued fifth wave, Colorado is ranked among the bottom 10 states of COVID-19 mortality in relation to the population. Despite the fact that older people still have a higher chance of dying from the virus, Colorado Department of Health and Environment reports that those 75 and older accounted for around 44% of the deaths in the most recent wave of COVID-19. Although it has significantly decreased from an average of 62 in preceding waves, deaths among the middle-aged and younger people are still rather common. If more people have received vaccine, fewer would have died, but high vaccination rates among older population help to lower the death toll. It didn't seem likely that the state would have ever again be concerned about hospitality capacity when the first COVID-19 immunization arrived in Colorado a year ago. Cases and hospitalization were both declining rapidly from the week of the third wave in early December. Instead of the fretting about whether the state might run out of the hospital bed, officials talked about when there would be enough dosages available to everyone who wanted the shot and who would go first. Contrary to the expectation, a surge in demand during the first few months that vaccines was available led to more people delaying receiving those shots. Due to their critical role in averting hospitalization and fatalities from infection disease, as well as their contribution to halting their spread, vaccines have significantly impacted the infection and severity of illness. Both those who have received immunization and those who have not must be aware of additional preventive measures such as putting on the mask and social distancing. The global effects of COVID-19 epidemic has resulted in a presented level of public interest in the vaccine. This emphasizes that vaccination development as well as regulatory evaluation and safety control, social media and the media in general have contributed significantly to this coverage. And those are my reference. Thank you very much. Bye.